Hello, my name is Kate, and I'm an occupational therapist at VCU Health in Richmond, Virginia for the past 10 years. Over the past 5 years, I've been working specifically in an outpatient neurology clinic with a special focus on working with clients and families that are affected by progressive neurodegenerative diagnoses. So I'm very excited to connect with you all for the virtual family conference today, just to spread awareness about what occupational therapy is as a profession and how it can help increase quality of life for those who are living with neurodegenerative diagnoses such as PSP, CBD, and MSA. So without further ado, we'll take it over to the presentation. So occupational therapy. A lot of people ask me, what is an occupational therapist? And I think a great place to start is by addressing what is an occupation. A lot of times there's a misconception that solely relates to having a profession, a job, a career. But an occupation is a life activity, and that can include basically anything that occupies your time. A lot of times we categorize these into activities of daily living, also known as ADLs, instrumental activities of daily living, which are higher level activities such as meal prep, managing money, and it does include work. Occupations also include things like rest and sleep. Yes, you heard that right. That is an occupation. Education, work, play, leisure, and social participation. All of these things are the activities that occupy our time. We're occupational beings as humans. And the American Occupational Therapy Association defines that the central goal of occupational therapy is to assist others in achieving health, well-being, and participation in life through engagement in those occupations. So to really break that down, as an OT, my role is to help people be able to do the things they want and need to do. And a lot of times I'm looking at how to help people be efficient, how to be safe, and how to be as independent as possible with all of those activities that give their life meaning. And some different ways that we can go about looking at that is maybe we're helping someone with a neuroprogressive diagnosis increase a skill, learn a new skill, or we may be looking at how to adapt and modify the environment or the activity where a person performs meaningful occupations. And we'll talk a little bit more about what that looks like as the presentation goes on. Another primary role of OT, we help support care partners. We provide training and education to loved ones who are helping care for those with these diagnoses. So this diagram I included really just to highlight how occupational performance is such a complex network of factors. So occupational performance is our ability to plan and carry out those meaningful tasks, our roles, our routines. So things like our self-care, our productivity, leisure, and rest. And so you can see how many things really factor into our ability to participate in life. So, as an occupational therapist, we have to be really client centered because all of these factors vary significantly from person to person. So, the evaluation process with occupational therapy really examines these different facets of occupational performance. We have to figure out who the client is, what they find meaningful, what are their strengths and barriers that impact their ability to do the meaningful tasks in their lives. And then we really work with the client and their loved ones to generate goals collaboratively. So OTs really have a deep respect and understanding of how central these occupations are to a person's identity. you can see, we're really looking at not just, can you brush your teeth, can you get yourself dressed, but we're looking at, the meaning behind those activities, how that contributes to quality of life, how that plays into your habits, your roles, your routines. What are your beliefs around those specific activities? And so, moving on, a way that I like to conceptualize this to make it a little bit easier is, how do we as occupational therapists help create a good fit between the person we're working with, the activity they want to be able to perform that's meaningful to them, and the environment where those activities are completed. So, considering the person, obviously, this is the central focus. So, the client is first and foremost. Our job as OTs is really to help empower people with neurodegenerative diagnoses. So, we're helping them facilitate gaining knowledge and skills and confidence to manage living with a chronic disease. So we're really helping the client focus on their needs, how to activate their resources, and then how to learn to live with that diagnosis. And so a lot of times we're teaching things like self-management strategies. And again, these self-management strategies are just ways to empower them to manage the diagnosis. So we may look at things like training skills in an activity. We may look at how to train the use of compensatory strategies to help support engagement in an activity. Things like mental rehearsal or some self-talk, really paying conscious attention to tasks. Teaching clients and loved ones how to break a task down to increase independence. Looking at positioning, posture, body mechanics. And then also looking at, how do we help this person facilitate a positive outlook on life? Because that's so important. We want to maximize that quality of life. And then exercise, of course, does play a role for the person, because we're really working to maybe increase things like strength and gross motor coordination, fine motor skills, some of those things that really play into our ability to participate in those meaningful tasks. So moving on, considering the environment. So the role of OT as it relates to the environment, we're helping, first and foremost, clients and loved ones select and create environments that really support that safe and independent participation. This can help make the activities less stressful and more fun when the environment is set up for success. And sometimes that means looking at physical environmental adaptations or modifications. So things like adjusting the layout of the environment, how to maximize the lighting for better visibility. It may mean introducing some adaptive equipment, and we'll look a little bit deeper at some of those devices later on. It may mean addressing the social environment. So this is oftentimes in the context of how to train care partners and loved ones to help support that person in their environment. So there are a lot of ways that OT really look at the environment of the person to help support that engagement. And working in an outpatient setting, it takes a little bit more creativity, but I've had great success with having clients and their loved ones go home and take a video, give me a video tour with their smartphone. And then we can really look at, okay, how can we modify that environment so that you're able to get from the living room to the kitchen safely so that you can have meals with your family. So really just looking at the environment and getting creative and how we can adjust that to support the client is the role of OT here. And then, of course, we're considering the occupation. So these are those tasks that give the person's life meaning. So with occupational therapy, we're looking at how to help clients and their loved ones maybe make some adjustments in activities. And this may be through simplifying or modifying the activity slightly. Sometimes it's helping them select new activities that they may find meaningful. Oftentimes this pops up in the context of leisure. Sometimes folks find that they can't, go out kayaking the way that they used to. And so sometimes it's about problem solving with the client and their loved ones about, okay, well, let's think about what are the things that you're interested in, what gets you excited, and then looking at what are some alternative solutions that may be safer, because we really want to support folks in getting out and doing things that they enjoy. So when we're thinking about the activity, sometimes it involves just simply simplifying the task. And this could be as minor as encouraging someone to sit down to participate in meal prep. So maybe changing a little bit of the way the task is done. So perhaps instead of actually cooking a 5-course meal, maybe we simplify that into assisting with the meal prep. Or maybe it involves learning how to simplify meal prep by using something like a crock pot. When we look at different tasks but the same outcome, we could think about that as, perhaps there's someone who really values golf as a leisure activity. But when we explore that a little bit deeper and look at the meaning behind going golfing, perhaps the client really, the overarching goal is that they just want to be able to meet with their friends and have that social interaction. And so sometimes the task may be, instead of getting out on the golf course and hitting golf balls, it could be, we ride in the golf cart together, and then at the end, we meet at the clubhouse for lunch. So again, it's a different task, but you're still having a similar outcome. And then part of what we look at with occupation is also collaborating with a client to set personal goals for those activities they want to enjoy. And we really want, again, we're empowering clients, so we want to formalize those goals by writing them down, sharing those with family and friends, allowing that person to really take ownership of those goals, being a really active participant in their therapy and in their care. And so those are some of the ways that we really look from an occupational therapy standpoint about how to facilitate a match between the person, their environment, and the activities that are meaningful. But again, as you saw from the diagram at the beginning, it's a really complex network of factors that we have to consider. So oftentimes I'm asked from care partners and loved ones, how can I help? So again, it's going to vary from person to person, and that's why it's so helpful to meet with an occupational therapist and to meet with them early on after diagnosis. But with care partners, a lot of times we'll encourage providing very simple, clear, one-step directions to help guide self-care if the person's requiring some assistance. Again, really the goal is to create that sense of empowerment. So explaining what you're planning on doing, asking for the person's permission, really allowing them to be an active participant in the task. Set those goals collaboratively. And then another thing that's very helpful, if you're assisting a loved one with activities of daily living, I have an example here of putting on a shirt, but really breaking down activities. Oftentimes, what we perceive as being a very routine task to a person with a diagnosis like PSP or CBD or MSA, it's really not just a routine task. But we can foster success with the task by focusing on those individual components. So maybe rather than cueing, hey, let's put your shirt on, it might be, okay, thread your right arm into the shirt. And that's after maybe helping orient to the clothes. And now let's put the left arm in. And now let's pull the shirt overhead. And now let's manage it down over the trunk. So, really looking at a task and breaking it down into those bite-sized pieces can help foster your loved one's independent success, more efficient success. And then, of course, in the event of any type of fatigue or frustration, it's really helped to provide those short rest breaks, demonstrating that empathy, that compassion. And then, of course, with activities of daily living, there's always the opportunity to introduce adaptive equipment when it's needed. I do believe that less is best, but oftentimes there is adaptive equipment that can help increase that independence and efficiency. And this is where it may be helpful too to check out that assistive devices and equipment resources page through CurePSP. But we'll get into just some of the most common types of adaptive equipment that may be helpful with specific ADLs here next. So let's talk about eating, because that's something we all typically do, and it's a really meaningful task for most folks. So first and foremost, one thing that can prove to be really helpful before introducing any type of adaptive equipment is consider positioning. Positioning is number one, because this can help facilitate and set someone up for success, and you don't have to have any extra stuff. So if you think about with the task of eating, have someone sit at a table in a chair with a backrest, a supportive seat, and that's something that can be really simple and can help increase the independence with the task tremendously, versus maybe, someone who's traditionally sat in a comfy, cushy recliner with, a TV tray to eat their dinner off of. So changing up that positioning can really foster that success. Having the person sit as close as possible to the table and propping the forearms or the elbows on the table to create more stability for eating. Sometimes it's looking at increasing contrast on the plate to help boost visibility. And then obviously there's the option to introduce different types of adaptive equipment if that's needed. So some of the adaptive equipment that might be helpful is sectioned plates. So this is a plate on the far left with a built-up lip around it, and it's just divided. So it can make scooping food a little bit easier if someone finds that maybe it's a challenge and they're chasing their food around on the plate. That's something really simple that can be implemented. Built-up utensils can be really helpful to facilitate a more efficient grasp. Using something like a travel mug with a lid and a handle can be very helpful for maximizing stability when you're drinking from a cup. Using a non-skid placemat underneath the plate to create that stability. And then sometimes with cutting food, that can be a challenge, coordinating a fork and a knife together. And so that's where sometimes I have folks explore the use of a mezzaluna or some sort of a rocker knife that can be used one-handed or two-handed, but it allows more of a fluid rocking motion back and forth versus the sawing traditional motion with a fork and a knife. And again, just to be clear, needs are going to vary from person to person. We saw how important it is to be client-centered and how things can vary between individuals. So one piece of adaptive equipment will never be applicable to every single person with a diagnosis like PSP or CBD or MSA. So moving on, we'll talk a little bit about bath equipment. So one of the things that can be helpful, again, going back to what we were speaking about before, breaking down a task, if a loved one is helping someone with the activity of bathing, sometimes it's really helpful to just provide those simple, clear one-step cues. Because again, bathing is a very complex activity. There's multiple things involved. Perhaps it's putting some high contrast tape on the shower threshold to increase visibility for safety with stepping in to the shower. I've had folks put high contrast tape on grab bars to increase use of the grab bars if those are present. And then looking at just some simple modifications. Of course, there are many, many ways that the environment can be modified to enhance safety with bathing, but some simple ones that are fairly common would be introducing the idea of a shower chair or a tub bench if it's a tub shower combo, and just allowing yourself to sit to bathe, because that helps simplify the task and it really helps with um, reducing fall risk. There's also the option to have an entire shower or tub transfer system. And so the one that I have pictured here in the center is a padded seat, but it allows the person to essentially roll that chair. It's on wheels. You can roll it over the commode, or you can clip it into the track system and then slide it over into a shower. So it helps eliminate the need for multiple transfers, which helps with caregivers for their body mechanics and energy conservation, but also the person with the diagnosis. It helps them to be safer, save their energy. Some really simple strategies too for bathing could include introducing the idea of pump style bottles in the showers for all of the products. So maybe shampoo, conditioner, body wash, those are all available in a pump style bottle and positioned within easy reach in a suction cup shower caddy on the wall next to a seat. That really eliminates the need to have to pick up a container, manage the top, squirt it into the hand. So again, we're looking at how to simplify. And then there's also the opportunity for something like an adaptive wash mitt. So if it's challenging to hang on to a washcloth, this is a simple mitt that you can slide your hand into, and that just allows you to wash your body without having to worry about dropping the cloth. Considering grooming, again, simplifying the task for safety. So it may mean sitting down to groom and sitting down where there's really good visibility. So lighting is so important for grooming. And maybe introducing a magnified mirror to help boost visibility. Again, providing really simple one-step cues for thoroughness. And then with regards to adaptive equipment for grooming, the possibilities are really endless. Some very basic concepts that a lot of people use, it's just universal design, would be something like maybe an electric razor versus a standard straight blade. Or it could be something like an electric toothbrush, just to maximize thoroughness. There are now 360-degree hands-free toothbrushes that are on the market. So those are really helpful sometimes if the motor planning of using a toothbrush in all planes of the mouth is tricky. It's kind of like a little mouth guard that you put in and you press a button. And then these little bristles vibrate around 360 degrees for top and bottom teeth. And then, of course, there are things like adaptive nail clippers. It's just tabletop mounted. If someone has issues with fine motor coordination, something like that makes it really, really easy. Or the concept of maybe just using a nail file or an emery board versus, nail trimmers. So again, just looking at ways to adapt the task to make it more efficient, more safe, more independent, and that will vary from person to person based on their strengths and what the barriers are. And then moving on to dressing. So with dressing, again, positioning is first and foremost. I usually encourage a person to sit in a supportive chair again, backrests, armrests, because that also helps with transitions between sitting and standing. But sitting down to get the lower body dressed is incredibly helpful. It makes accessing your feet and ankles a little bit easier. It takes out some of that risk for falls. It helps save energy. Things like using a no tie elastic shoelacing system. I love lock laces just because they are universal. A lot of trail runners and triathletes use them, and you can get them in any color for your outfit. There's also the option for things like Velcro strapping or slip ons. And then things like clothing. I know Joanna mentioned adaptive clothing lines. So there are many adaptive clothing lines now out on the market. There used to only be a few, but it's becoming more and more recognized as a need. But considering things like dress shirts with magnetically infused buttons, it makes that task of getting dressed and undressed incredibly efficient. Or considering pants that have a Velcro fly or a magnetic fly versus the traditional zipper and button. Some of these things are really helpful for dressing. There are many other types of adaptive equipment that are available, things like long-handled reachers, sock aids, dressing sticks. The list goes on and on. But again, it really is going to vary from person to person based on what their needs are. And as always, as I've mentioned, breaking down the tasks of getting dressed can be incredibly helpful. So if you are a loved one helping someone with a diagnosis to get dressed, really giving those simple, clear one-step cues and guiding them through the process of getting dressed can really help with empowering your loved one and help them be successful. So we'll move on next to toileting. It's a very important ADL. So with toileting, again, many different types of adaptive equipment that can be used. Different types of modifications can be made to the bathroom to make the commode more accessible. Some simple strategies could be just introducing the use of a bedside commode or a toilet safety frame that goes directly over the toilet. It just helps to increase the height of the commode, provide armrests, which makes transitions between sitting and standing a little bit easier. Of course, there are power assisted toilet lifts that are available now on the market. So those can be incredibly helpful as well. Usually encourage the use of flushable wet wipes for hygiene just because it helps with thoroughness. Or some folks have found that using a bidet attachment can be really helpful for just that thoroughness with hygiene. And it helps them maintain that sense of independence with hygiene with toileting, which is so important. There's also the option to use grab bars to facilitate more safety with transitioning on and off the commode. And again, this is where I may suggest something like putting brightly colored contrast tape on a grab bar to boost visibility, just to encourage that consistent use for safety. What I really would like to stress from an OT standpoint is that it's so important to know that anyone with this type of diagnosis is going through a life-changing event. And it's so important to try to see from that person's perspective and work towards small successes and celebrate those small successes each day. Again, empowering people to set goals collaboratively. And then also from a collaborative standpoint, it's so important to really have that connection with a multidisciplinary team. As a care partner, I would also really consider your own self-care because that's so important. You're a very important part of the equation. And so finding ways to nourish yourself in your daily life is essential. It's crucial. And so you can always talk with an occupational therapist about those things as well. And that is it for my presentation, just explaining the role of OT, but I'm happy to take any questions if there are some.
Thank you so much, Dr. Roberts, for being with us today. This was incredibly helpful. We do have a couple of questions to encourage the audience to drop those questions in our chat box as well as we're going along here. One of the first questions that we had come in through registration was, when do we know that a person is doing too much? Often my family member tells me that they don't really know how to tell when they're really tired from what they're doing.
So, are we thinking about, I guess, to clarify, how to know that you're doing too much if you're the person living with the diagnosis, or how to know if you're doing too much as a loved one helping the person with a diagnosis?
I think they're speaking about the patient themselves, how to tell when the patient is overly tired.
Sure. So I think that, and we do a lot of education on energy conservation in occupational therapy. So, first and foremost, it's really important to prioritize during the day. And a lot of times I'll recommend the use of something like a weekly planner, a way to really visualize the schedule. That's incredibly helpful. And then prioritizing what tasks need to be done, what's most essential, and then scheduling some rest breaks, because again, that balancing work with rest is really important. So we certainly want to emphasize the tasks that are highest priority, because that's what's going to be most meaningful and maximize quality of life. And then maybe if there are other tasks that aren't as important that could wait, then they could be, redistributed throughout the week. But getting to recognize your signs and symptoms of fatigue is also crucial. So we want to start to recognize those and include some of those energy conservation strategies before it gets to the point that you feel totally wiped out. So I think it's just having an honest conversation with your loved one and discussing what their primary goals are, what they really want to accomplish in their day, and then encouraging them to balance that work with rest. And it doesn't necessarily have to mean taking a nap, but maybe just considering what's important to them. What do they enjoy? What kind of quiet leisure activities do they find meaningful? And maybe just incorporating some of those during the day. I think that can be really helpful.
All great information. Thank you so much for that. We had another question that just came in, and what is the best way to handle sundowner syndrome?
Sundowning. Okay. So, again, that frequent reorientation is going to be helpful. Maintaining a calm demeanor yourself is really helpful. And maybe in the hours leading up to it, just reminding about, that frequent reorientation, what the plan is, what's going on. Sometimes having some visual cues in the environment is helpful. And creating somewhat of a predictable schedule can be really helpful for that as well. A lot of times, if the routine tends to vary quite a bit and be a little bit more unpredictable from day to day, that can create more stress in those later hours of the day. So, at least for the second half of the day, I know life is not predictable, but trying to create as much predictability with routine for that afternoon is very helpful for that.
Excellent, excellent. Another person wanted to know, is the Parkinson's program Think Big, Think Loud applicable to CBD as well?
Um, so I like to think, the principles of big are really the intensity of the therapy, working on amplitude based movement strategies, and you're trying to promote neuroplasticity. So there are principles of the program that could be applied to treatment for people with CBD. It just kind of depends on what the person's strengths are and what their barriers are. It's a good question. I tend to like to take concepts from that treatment strategy and kind of create my own protocol based on that specific person's needs. more so than maybe going through that exact protocol. But absolutely, I mean, working on the movement patterns because it's intensive. You're doing this for 4 weeks, 4 days a week, and then doing it at home as well. So it's really meant to help promote um, more calibrated movement patterns. So, I mean, it certainly can assist if the motor component is something that you're working towards as part of therapy.
Thank you. Could you go into a little bit more detail about what the benefit of patient lifts are?
Absolutely. So patient lifts there are many different types, but typically later, as diseases progress and mobility becomes a little bit more challenging, patient lifts can be incredibly helpful to just boost safety with functional transfers for the person living with a diagnosis and to really help preserve the body mechanics and the energy of those care partners who are assisting with transfers. So we will typically recommend those, especially when transfers just become very challenging or not safe. There are different types that are available. There are hydraulic Hoyer lifts, which are typically the ones that are covered by insurance. It's just a patient lift. It has a sling that goes with it. And then there's a manual hydraulic pump that you use that elevates the loved one up. And then it's on wheels. So then you can transport them maybe from a chair to a bed or to a commode. There are also fully electric Hoyer lifts that are available. There are sit to stand assists that are available. So maybe the goal is just to help someone go safely from a seated position, transitioning up to standing and then back to seated. And those are typically on wheels as well. So maybe coming up to stand, transferring to a different area, and then coming back to sit. And again, it's going to vary based on a person's strengths and what their limitations are, what the home setup is like. That environmental piece is really important, space considerations, depending on the type of lift, because they can be a little bit large. But that's always something I encourage folks, as mobility becomes a little bit more challenging, to talk to a physical therapist, an occupational therapist, because we all kind of collaborate together to figure out what the safest option would be.
Thank you very much. So, when it comes to patients and sleep, how many hours a night would be considered normal?
What's considered normal for any of us anymore? You know, everyone, I like to say, what was the person's sleep routine like really before diagnosis? Were they a night owl traditionally? Did they usually go to bed early? Because, it's okay to allow that person to enjoy their normal pattern of sleep. Obviously, the recommendation is anywhere from 6 to 8 hours, and that is what, science recommends as far as making sure that we're well rested. I would say the biggest consideration is going to be during the day. Does that person struggle with fatigue consistently? And is that because they're not getting enough sleep at night? Do they get up frequently at night? And there are so many things that play into sleep. From an occupational therapy standpoint, a lot of times I'll recommend a lot of sleep hygiene strategies, encourage things like limiting blue light exposure a couple hours before bedtime, making sure that you limit fluid intake a couple hours before bedtime, emptying your bladder before going to bed, having a routine before bed that includes more quiet leisure tasks or relaxation, just to help improve sleep quality as the night, progresses. And then, of course, that's something that's such a multidisciplinary management consideration. So that's usually where we'll have the doctors involved in looking at, medication management and other suggestions that might be helpful for sleep as well.
Thank you. We had a follow-up question to lifts. Where does one get access to lifts, and what are the general costs?
So I typically recommend that you collaborate with a therapist because they're going to have a ton of knowledge about different kinds of lifts and help you really look at which lift is going to suit you best. But there are many different vendors and equipment companies that you can go through to get a lift. The price varies considerably. For a standard hydraulic Hoyer lift, I mean, maybe $1,000. For something like a fully powered lift, those can get pretty pricey, like 3 or 4 grand. So again, it varies. If it's a simple sit to stand without any type of motor feature, several $100s. So big variance in price points, but again, it's so helpful to have a therapist guide you through that because it's an intimidating process when you go online by yourself and try to look for things on your own. It can be really challenging.
Thank you. I'd like to know what device is good to have on hand when one does have a fall that a caretaker could use to have backup.
That's where I'd say a patient lift. Having a patient lift can be really helpful. And if it's something like a Hoyer lift, whether hydraulic or fully electric, those you can use. They lower all the way down to the ground. So that allows you to be able to get up from the floor using that lift. It can be much safer than a care partner trying to lift someone on their own. It's risky for their backs, for the person who's on the floor. So those lifts can be really helpful for those ground level transfers.
Terrific. Can you talk a little bit more about beds, bed heights, when a lifting bed is necessary, attaching rails, etc.?
Sure. So again, varies from person to person depending on what their needs are. It could be introducing something as simple as a bed rail that has kind of a board that slides under the mattress and attaches there and then comes up, and that bed rail can assist with just transitioning into and out of bed. It can assist with rolling in bed. There are options like something like a sleep number bed where you have adjustability with the head of the bed and with the foot of the bed. It also allows you to, I believe these beds help, you can control the firmness or the softness of the mattress. If you wanted to go with something that's more commercially based and have that adjustability, of course, there's always the option for looking at something like a hospital bed that gives you the adjustability of the head of the bed, the foot of the bed, but then also the overall height of the bed can adjust going up and down. And that can be super helpful if a person is doing the majority of their activities of daily living at bed level, because then if a loved one is helping that person, then you can elevate the bed height so that you're preserving your body mechanics and saving your back as well. It really just depends on the height of the bed based on the height of the person and, their ability to transition in and out. Typically, firmer mattresses are much easier to move on, transitioning onto and off of the bed, but also being able to turn and roll in bed, that can make quite a difference as well.
Well, that was fantastic, and that's all the time we have for today. We have that was our last question, and I just want to thank you so much on behalf of CurePSP for being with us today.